All right, hello and welcome. So in this practice, we are going to be focusing on creating just a little bit more space in our groin, our inner thigh area, in our hips, just to release any tension or, as a lot of people say, pent up emotions. You can see I have a whole line of props behind me. So for this practice, I recommend a myofascial release ball. You can have a little or a big one. I have 2 blocks. You may only need one. Koosh ball, which we'll get to, or a small like rolled up sock. I have multiple blankets, a bolster, and then a chair. If you're at home, I have like an ottoman in my living room, so I'll usually just do this on my ottoman. And then you can also do it like on the corner of a couch or even like a lower bed if you have like a bed that's lower to the ground. So we're just gonna go ahead and get started. I'm going to grab 1 block and my koosh ball, or if you have like your small rolled up sock, and we're just gonna get started in hero's pose. So I'm gonna sit on the lowest height for myself, and then the widest width in between my feet. I'm gonna make sure that my bum and then my perineum, so the space between my vaginal opening and my anus, are nice and nestled in there. And I'm gonna take my koosh ball, or you can take your rolled up sock, and just place it in that space. And if this is your first practice with me using that tool, it's really just here to provide a feedback mechanism. So as we breathe into our pelvic floor, we're gonna inhale and soften down into the koosh ball, and then exhale, we're just gonna relax and release. All right. So we're just gonna go ahead and get started here. You can rest your hands on your thighs. If it feels good to just kind of like interlace your fingers and have your palms up, that's an option as well. So just kind of find a place for your arms and your hands that works for you. We'll just go ahead and I'm going to soften my eyes closed. If it feels better for you to kind of soften your gaze on the horizon line in front of you, or maybe gaze at a nice pleasant object in your space, you can do that as well. And we're just going to start to settle into our bodies. And just start to notice the texture of your breath. Is your breath light? Is it dense? Is it choppy? Is it smooth? And then notice the pattern of your breath. So where does it want to go in your body as you inhale, as you exhale? Are there any places that it's getting stuck? And then see if you can start to lower your breath down into the bottom of your back rib cage. And no need to force, just see if you can just kind of gently guide it there. And then maybe as you inhale, you can breathe all the way into your low back. And then see if you can breathe all the way down into your pelvic bowl. And as you send your breath lower into your body, it might feel good to start to widen your breath from side to side, just letting yourself expand with every breath in and soften with every breath out. And then if it feels good for you, I like to imagine my breath almost as a stream of water moving down the back of my throat, along my spine, and into my pelvic bowl. And with every inhale, my pelvic bowl fills up with water and expands. And every exhale, the water just kind of swirls around, maybe gets flushed out a little bit. And I like to envision the water as kind of like a swirl of blue and orange and a little glitter because I like glitter. And as that water swirls, I notice if it gets caught anywhere within my pelvic bowl. And scan starting on the right side from like your right hip, and the inside of your right low back, your left lower back, your left hip, down into the front behind your pubic bone. Just continuing with a circular scan and seeing if there are any places that feel a little stuck, and like there's something there. Just letting the water that's kind of coming in through your inhales, let that just flush whatever needs to get moved around. Let that water just flush it out. And if it's something that feels a little bit bigger, you can imagine almost like a current, like a river inside of you, softening any rocks, or maybe taking any debris downstream and then down through the bottom of your pelvis. And if it feels good to just stick with this visualization, you can stay here. And if you're ready to move on to some movement, gently open your eyes if you closed them. And then slowly rock yourself forward. No need to go too quickly. If you need to tap out the tops of your feet or maybe tuck your toes under to get a little bit mobility in your ankles, you can do that. And then I'm just going to remove my block and I'm going to send my couche ball to the side. I'm actually going to grab my other block and I'm going to come into a gentle runner's lunge. So I've got both of my blocks on the tallest height here. I'm going to bring my right foot forward. I'm going to scoot my left knee back a little bit. And as I'm noticing this, I'm just kind of feeling like I would like a little extra cushion underneath my back knee. So you're welcome to do this as well. If you're ever in a kneeling position and you just feel like your knees against the floor is not the most fun, you can always grab a blanket and just bring it under your back knee. And then I'm bringing my hands to the blocks at the highest height. We're just going to find like a little bit of gentle, like rocking forward and back. So kind of into like a runner's lunge and then like a half splits position, but I'm really not going back into like a full half Hanuman or half splits. Just finding a little bit of movement and fluidity. And my purpose here isn't really to stretch like my hamstring or the front of my left leg. It's really just to kind of tell my body like, hey, we're warming up. We're moving around a little bit. Getting unstuck is how I kind of like to think of this. All right, and then we are going to go into a full runner's lunge, a little bit more like yin style. So I'm actually going to bring, I am going to stick with my blocks. You can always bring a bolster here as well if you want to get a little bit lower, or you can lower your blocks to a different height. So I am just going to crawl my right foot forward and out a little bit, and then I'm going to allow my hips to sink a little bit low. Now I'm not going into like my full depth here. I'm just going to a place that feels like I'm getting a little bit of like a pulling sensation in the front of my left leg, but by no means is it painful. It's, maybe just slightly on the edge of discomfort in a way that feels like it's creating like a sense of opening. But again, we're not going for pain here. We're not going for we're not striving to get more flexible. We're just here to create a little bit more of a sense of opening in our bodies. And I'm going to go ahead and drop my head Relax my neck. I'm going to be a little bit active in my upper body by pressing down through my hands and back through my heart. And the reason for that is I'm someone who has a lot of tendency for rib flare, and I think that's actually pretty common for some of us with vaginismus. And so I'm just trying to be mindful of not letting my ribs pop forward. And we're just going to hold and breathe here for a little bit. And one of the reasons I like this position specifically for working with my vaginismus is I do get a little bit of a tension in the area of like my hip flexors and the fronts of my legs. And this does provide maybe like a gentle sense of stretching, but really what I'm trying to do here is relax my pelvic floor while creating the sense of opening in that area. And so I'm still focusing on breathing into my pelvic floor. And if it helps to imagine you still have your koosh ball or your sock in that space. And especially when we're in this kind of like different position. And we'll take just a couple more breaths here. And then I'm just going to gently walk my hands back, bring my right foot back. And I'm just going to take a kneeling position just for a few breaths, just to kind of like recalibrate my body. And then if you're ready, you can join me on the next side. So I'm going to bring my blocks more to the right this time, bringing my left foot forward. And then again, just finding some gentle movement front and back. Again, not really finding a stretch, just kind of telling our muscles and our nerves like, hey, we're moving now. This is what movement feels like, especially if you're like me and you sit at a desk for most of your day. Just kind of a nice way to wake up our body. All right, and then I'm gonna go ahead and I'm gonna crawl my left foot a little bit more up and out. And then I'm going to allow my hips to sink low. And again, if this doesn't feel great for you, you always have the option to just continue with that flossing movement. Or, you can go back into hero's pose or do something completely different. It's all up to you. And again, I'm pressing into my block. I'm keeping my elbows a little bit soft and then just pressing back through my heart and then letting my head hang really heavy. And as you start to settle into this space, again, we're bringing our attention to the pelvic area. And so see if you can find that sense of release and opening with every inhale. And exhale as you can just continue to soften. And then I'm also just paying attention to my jaw, my throat, creating a sense of softness there. Notice your eyebrows, see if you can relax those. There is a connection between the jaw and the pelvic floor through fascial networks, through nerves. And so it's nice to kind of go back and forth with our attention between one and the other to see if as we soften one, we can soften the other. And then I'm just going to gently walk my hands back to come out of the posture. And I'm just coming to a kneeling position, and I'm going to close my eyes just for a moment. Notice any shifts or changes in your pelvic floor, in your breath pattern. If you closed your eyes, go ahead and open them. And we are going to transition into a wide-legged forward fold. So we'll be using the chair to do that. Again, if you are in like a living room and you have an ottoman, you can feel free to use that. If you have a bed that's low to the ground, you can always use the corner of your bed. What we're going to be doing here, I'm going to just sit on this blanket that I have already on the ground. I'm going to bring the chair a little bit closer to me. And then I'm going to grab my bolster. And I'm going to kind of prop it up here. I think that should be pretty stable. You can always kind of use blocks to help prop you up as well. And then I'm going to have my blocks nearby in case I need them. And I'm also going to grab my myofascial ball. So with my block, I'm actually just going to go ahead and rest that up at the top of my bolster. Again, if you're using a piece of furniture, you can also just like rest your block on top of there. The reason that I'm having a block right here is just because it provides like a smoother surface for what we're about to do. So we're going to go ahead and do a little bit of MFR on our jaw. And so I'm just going to start by placing the ball kind of a little closer to my ear, kind of in that like little nook by my cheekbone. And I'm just going to go ahead and rest the side of my face on the ball, and the ball on the block, and the block on the bolster, and the bolster on the chair. And go ahead and close your eyes and just kind of soften into this space. And something I want to call out with my wide-legged position here is like I am nowhere near in a place where this is like really providing me with an actual stretch. This is really just to help my body relax in a different pose. And so you can adjust your stance by bringing your legs a little bit closer. You can always put more blankets underneath your bum. And you may not even need the bolster depending upon what kind of furniture that you have available to you. You might just be able to kind of like snuggle up right next to it and then just rest your head down. And I'm going to go ahead and I'm going to move the myofascial release ball a little bit closer to my nose. So about like halfway on my cheek. And again, just kind of in that little crevice on the side of my face and my jaw. And you can find gentle movement here. It's like gently rocking your head side to side, giving yourself like a little massage. And again, see if you can soften your shoulders, soften your jaw. I'm going to find one more position on this side of the ball, again, a little bit closer to my mouth and my nose. And then I'm going to transition to the other side. So again, I'm going to start on the outer edge of my face and my jaw, just because that's where I hold a lot of tension. You can just find a space that feels good for you. And if you lost track of your breath, you can come back to that, breathing into your lower back, all the way down into your pelvic floor. Breathe into your groin area and your inner thighs. And just soften any spaces that feel like they're still holding some tension. And then I'm going to move my MFR ball more to the middle of my face. And if you find any hot spots, just breathe into them. And then move the MFR ball one more time. And this is a great exercise you can just do in the middle of your day or maybe before bed for as long as you need to. And then I'm gently going to release my MFR ball, come back up to a seated position. And then I'm going to maneuver all of my props back over here. If it feels good to windshield wiper your knees just a couple of times, feel free to do so. And then lastly, we're going to be getting into either a half child's pose or prone frog. So I will walk us through half child's pose first. We'll be using blankets and the bolster for both. So I know that for my child's pose, I like a little bit of a thicker blanket. So I'm just gonna rest that on my heels. And then I'm going to bring my bolster out in front of me. And so if you're doing half child's pose, I'm also gonna put another blanket on my bolster, a little bit up here at the top. We'll extend one leg out to the side if you're familiar with gate pose. We're gonna start in a gate pose, and then I'm gently gonna lay my hip back. I'm gonna sneak my bolster into the inner part of my right knee. And then I'm just gonna go ahead and lay down on my bolster and my blanket. And so this is option one. You can stay there if this feels good for you. If you'd like a little bit of a deeper opening, we're gonna go for a prone frog. So I am going to bring blankets to either side for my knees, just because I think that will feel better in my body. I'm gonna bring another blanket, fold it up a little bit toward the top of my bolster. And so for prone frog, we are just going to find a wide stance with our knees. And then I'm striving to have more of a straighter line from my knee to my ankle. And then my toes are kind of pointing out to the side. So we're finding some external rotation here. And then I'm just gonna lower my upper body down to the bolster. And I'm gonna let my hips start to sink low. We might need to find a little bit of adjustment on the placement of the bolster in comparison to our knees. If you're feeling a little tight here, sometimes I feel it feels like good in my body to just kind of like rock back and forth a little bit before fully lowering myself down. And that also helps me find like an angle of like my pelvis to my knees that feels good. You can also, if the bolster is too low, you can stack another bolster underneath it, or you can bring a block or two underneath your bolster to give you a little bit more height up toward your chest. And once you've found a position that works for you, you can start to settle in. And if you found half child's pose, you can go ahead and switch sides. And the goal here is really just to release any pent-up tension in your inner thighs or your groin area, your hips. And so if anything comes up during this pose, go ahead and let it happen. So if you have some sort of somatic release, tears, crying, sighs, anything like that, that's all totally normal. And letting it out is helpful. So do what you need to do. And if you're in a space where you feel comfortable sounding, you can make any noises that feel like they need to come up and out of your pelvic floor. Again, you can start with a sigh and then just see what comes out. And again, always just remembering to keep breathing down into your pelvic floor, into your perineum. And if it helps, you can imagine a feedback mechanism there, like we've done in other practices. If you're ready to make your way out, you can gently press your hands up, draw your knees inward. And again, if it helps to windshield wiper your knees back and forth, side to side. Go ahead. Again, you can stay anywhere you, if you need to kind of repeat any poses, feel free to do so. And I will see you in the next class.